I'm a consultant gynecologist and obstetrician. I'm practicing in Durgapur, West Bengal. So in this preterm birth awareness month, I'm just going to give you a little bit idea about the preterm birth. What is preterm birth and how can we prevent it and how to know what to deal with it. So first of all, the pregnancies are actually a 40-week pregnancy. If the pregnancy goes beyond 37 weeks, then we can call it a term pregnancy. So 37 weeks, the baby weight gets matured. But if it is below 37 weeks, if you are experiencing a delivery, your delivery has to be done before 37 weeks, then it is called a preterm birth. Now again, the preterm births can be further subdivided into extreme preterm birth or just preterm birth. Okay, so if it is 34 to 37, then it is preterm, but before 37, it calls extreme preterm birth. Now what is the problem? With India, we are experiencing a lot of preterm birth nowadays. So India is ranked among the number one in the global indexes regarding the preterm birth. It is estimated that almost 1 out of 10 preterm births are happening in India. So basically, it is a very big situation we are facing in India right now. So that's why you have to be very careful about preterm birth. Now, people ask us that who are the people who are actually at risk of having preterm birth. So basically, every pregnancy has a risk of preterm birth, but more patients, there are a few patients who are at more risk. Now, who are those patients? Like, if you have a previous pregnancy, you have experienced a preterm birth, in this pregnancy also you have a risk of that. If you have any cervical pathologies, for that you have undergone a cervical surgery, then you are again at a risk of preterm birth. And people who are carrying more than one fetus, like twin pregnancy, triplet pregnancy, they are at risk of preterm birth. And there are also some patients experience weakness of the cervix. And that weakness of cervix is now called as cervical insufficiency. If you have this kind of thing, then again you can get predisposed to having a preterm birth. There are a few more like maternal smoking and low weight gain. Patients whose age are less than 17 or more than 35, these patients usually tend to have more preterm birth. But it's not necessarily that if your age is more than 35, you are bound to get preterm birth. But these patients who are at more risk of developing preterm birth. Now the next thing is, if you are suffering from preterm birth, now how to know? Because suppose your expected date is far away, 2 months or 3 months away, and now you are experiencing some pain or some discharge from the vagina or some fluid discharge or bleeding, then you might be suffering from preterm birth. So these situations you should directly consult your doctor, obstetrician as early as possible. Now, how to manage this? Because the preterm birth management, you cannot do it at home. So first of all, you have to go to a hospital, preferably a tertiary care hospital with a good NICU facility. Because if you are suffering preterm birth, then might be the delivery is imminent within few days. And your doctor may give you some medications to prevent the uterine contraction, for delay the labor,